so many know that we are really losing people out here. People are dying. Like, they don't understand like how serious this is. People are dying. Let me say that again. People are dying in the streets.
Every day.
Every day.
Moms.
Moms! Yes, moms! Thank you for being here. Who else here wants to end the addiction crisis?
Responsibility. This is their state. Do something. Alcohol-related deaths have increased 73%. No action is taken.
None.
Well, I shouldn't say that. They held a special session to approve home alcohol delivery. Woohoo!
Yeah, boo!
Drug overdose fatalities have increased 39%. No action has been taken. Available adult residential treatment beds have declined 43%. No action taken. Available adolescent residential beds have declined 69%. 69%. Available detox beds have declined 45%. We started a public education campaign, Rethink the Drink, to reduce harmful alcohol consumption, which is now delayed indefinitely. No public education has been launched to prevent fentanyl poisoning. Moms? Not okay.
No word.
And Narcan remains unavailable in most of our schools. And last but certainly not least, $270 million in Measure 110 funds, our recovery funds, have been delayed until October. We need that money released now. So, it's time to take action or resign. So when I say take action, you say resign. Take action or resign. Take action or resign.
And there's a lot of people think that the number 13 is lucky. Well, in my family, let me tell you how lucky it was. On May 13th of 2012, which was Mother's Day, my brother Paul died from an overdose. On March 13th of 2015, my nephew Todd died from an overdose, and it was Good Friday. On January 13th of this year, my sister Lori overdosed, and we brought her back with Narcan. So that's how important it is to me as a mom to have Narcan be available for everyone. Now, the most important person that I want to talk about is my son Christopher. He has suffered from addiction for 16 years. Let me see. Where are you, Christopher? Where? Oh. Here you are. Here you are, son. Here he is. Here. My child. He died October 27th of 2012. No Narcan in sight. When are we going to change? When are we going to change here in Oregon?
Right.
We waited way too long. And I do want to tell you that there's two kids that told me today I could say their names. Emily Rask and Dakota Bear. There are two kids in their teens that are hurting right now. We need to help our kids listen to the voices of our children.
Amen.
Please do that. Thank you.
And Griffin to elicit fentanyl in a pill. And that's the angle that I want to talk to you about today. I recognize that my story is maybe a little different from some folks here, but it's also the same. There's connections here between what happened to my family and the two Portland families and what we're talking about here today. So I'm going to tell a little story. In December of 2020, just a few days before Christmas, my 18-year-old son, Cal, returned home from his first semester at college. Cal had been actively engaged with his community on the west side of Portland in theater, music, his friend circles. He gave swim lessons to little kids. He had great grades, multiple college offers and scholarships, a really tight family environment with family dinners, same age, close cousins running around together. In his first semester at college, he was also doing really great at school. He was well known and liked by his professors. He had a ton of friends. He enjoyed his electric skateboard and trying out new foods, things like that. Like many kids and adults, Cal also had some struggles, his with anxiety, and we, like many families, struggled to navigate the adolescent mental health care system. He was fortunate to find professional help and was developing tools to manage it in a healthy way. We'll never know if it was his anxiety or simple teen experimentation or exactly what led him to reach out for an OxyContin pill on the internet shortly after arriving home. We know he went on to Google. He checked what is the right dose of OxyContin for his weight, how it would interact with his anxiety medicine. We know he didn't get any information about fentanyl in that search, and we suspect that he, like us, really had no idea what fentanyl even was. So we lost Cal that day in December and came to understand the little bag of blue M30s that we found next to him that he bought over the internet were not the legitimate medicine that they were sold as, but instead were counterfeit pills made of illicit fentanyl. Cal was one of 98 youth who died from drugs in Oregon that year, 75 of those 100 involving fentanyl. The youth population in Oregon is now the fastest growing demographic of drug deaths, more than doubling in 1 year, driven by fentanyl, which has nearly tripled. Oregon has the sad distinction of having the fastest growing fentanyl deaths for youth in the entire United States. And for those kids fortunate enough to survive their initial experiences with fentanyl, we can expect to see an exploding need for youth treatment beds. All naive and opioid-naive populations need to be made aware of this risk. It's not only our dependent and addicted population or traditional at-risk youth. In the age of fentanyl, being a teenager on the internet is now at risk. Oregon should be doing all hands warning and alerts, billboards, social media campaigns, clinician coalition partnership to spread the word on this danger. And for the long run, Oregon needs to do what they should have done before decriminalizing, delivering holistic primary prevention services to kids.
Say that.
It should be driven from data, be evidence-based, include appropriate elements of harm reduction, understand risk and protective factors, and be updated to understand the synthetic landscape and refreshed regularly. This can and should be funded with settlement money. We know how to do this. We have the means to do it. We don't seem to have the leadership or political will to make it happen. We went to the governor, we asked for these things. We were told, talk to ADPC. Cal's choice to buy what he thought was medicine over the internet was a mistake, one he paid for with his life. I'd like other kids to not suffer Cal's fate, and I believe this plan, this 12-step plan being laid out, goes way beyond anything I've seen from our current programs or leadership. Thank you.
I first went to substance use treatment when I was 14 years old. And I'm up here today. I have a master's degree in business. I own a house. I have a beautiful family. I have so many blessings in my life, a wonderful husband. I own a business, so you guys, just stick with it. You're amazing. Thank you. I would also like to introduce an amazing group of individuals, some of the most powerful speakers I've ever heard. Can we please get the Oregon Moms for Addiction Recovery? Where are you guys at? Come on up, you guys. Let's get you in the front here. Right up here in front of the stage. So, if you are a parent to a person in recovery or a person who is suffering from the disease of addiction, and you want to get, oh no, and you lost power, hold on, and you want to get involved, these are the people to get hooked up with. So you can talk to Rebecca, and the purpose is support and advocacy. These guys are amazing. Can we get a round of applause?
Think or know that you're in recovery. And fighting a war against recovery. Okay. I'm in that army too. And I know that recovery, what it stands for, to me, is to retrieve those that have been held captive against their will from addiction or by addiction, correct? Yes. Okay, we gotta go recover ours, right? Yes. Right. We waiting on support. You know, the Hueys to come and drop our luggage off with our M16s, metaphorically speaking, y'all, you know, with our M16s, right, and all the supplies we need to fight this war, right? We fought many battles we've won, but the overall objective is to fight the war and win that. We can't do it without that support. How many of y'all agree to that? Without that support, I represent Miracles Club and every other organization, the Brown, the Indigenous, every community out here, as we all do. We need that assistance, that support. And 70 million, whatever, we need that money. We don't have any of it. And here it is, we steal out of love. Thank you. Testing. Well, this one ain't working either, but that's okay. Maybe I'll just hold it up here for extra support to come. Hello. Doesn't matter. 270 million, right? Yeah. We need the support. Nobody's giving us. Where's our air support at? They promised it would be on its way, and it's not here yet. We had dates in the past that they haven't reached. Is that a word, reached? It is now. I'm from the hood, so y'all just bear with me. We haven't reached yet. We need this support. We asked for it. We've been asking for it. At one point in time, remember they said we didn't have to ask for it because it was on its way. Well, it's not here yet. It's not here yet. So I ask that everybody continue to remain grounded and continue to fight for that support. It's on its way. We shouldn't have to wait till October, especially when you look around and people are dying on a daily basis, every day, every single day. Each passing second, history is being made. We don't want it to be full of deaths. We want it to be full of life. The only way that we can do that is to continue marching forth and demanding, to the best way we can, respectfully, that we receive the report or the support that they said we got coming. Everybody agree with that? Yeah. Like I said, I represent miracles and I believe in miracles.
But so over the last year, I've been given the opportunity to provide recovery services to the LGBTQ community as well as young people. And what I've noticed is that there's a desire to stay clean and sober, and it's overwhelming for addicts, right? The desire is there. What is not present is the availability of resources or a responsive system for marginalized communities. I have personally lost individuals I have worked with to overdoses while they were waiting for detox beds. You know, this happened last week for me. Someone that I've been working with for 9 months, waiting for detoxing, and just wasn't given the opportunity to go. When we were looking for housing or treatment beds for individuals within the LGBTQ community, I have found the system has not grown to meet the needs of a more diverse or gender diverse population. Measure 110 funds were supposed to help those in addiction access resources and expand services to communities that have notoriously been overlooked and ignored. And all I have found is that the longer I have worked in the field, the harder it is for my colleagues and I to find and connect people to life-saving programs. When an addict decides to get clean, there's a small window of opportunity that individuals in the recovery field can access to help solidify that decision. If we as professionals are unable to provide a menu of options, or even one option to these individuals, then more addicts are going to die. Period.
The Latino community. Let me tell you guys something right now. I'm proud of my people, okay? I'm very proud of my people because we come to this country looking for a better life. Yes. And we're struggling, right? We're afraid to ask for help. We get overwhelmed, we get depressed, we get anxiety, we get all that, and we start self-medicating. That's the way we are. The Latino community, that's who we are. We go straight to the bottle, if not that, straight to the drug when we get depressed and all that. But you know what? Thanks to the agency that I work for today, we are providing these resources and support. Okay? But we need this funding, right? There's only one Latina recovery transition house in Portland, right? Am I correct? Okay. We need more. I believe women are the backbone of this country. We need more Latino recovery houses. Okay. We need more detox. Yes. We do harm reduction on Fridays. Okay. I started putting out the message with this harm reduction outreach. I tell people, hey, if you're not the intravenous user, but your friend is, help out your friends. Give them that harm reduction kit. Teach them how to use the fentanyl strip. Teach them how to use Narcan. Teach them how to use responsibly so they can prevent from harming themselves. And then show them the direction of help, right? Señores y señoras, aquí estamos para hablar de que necesitamos los fondos para los recursos de recuperación. ¿Okay? Yo tengo ya 8 años aquí en este estado. Voy a cumplir 8 años de recuperación, gracias a Dios. Pero si no fuera por esos recursos, yo no estuviera yo aquí, si no fuera por el apoyo tampoco, ¿verdad? Pero lo que yo he visto en estos 8 años, que la ciudad se está yendo para abajo, no hay recuperación, parece. Y la razón por eso es porque no quieren soltar el dinero, que a nosotros nos pertenece, que a nosotros nos prometieron cuando sacaron la ley del 110. 270 millones de dólares que nos pertenecen a nosotros. Hay que decirles a esta gente, si no nos van a ayudar, que se larguen. And what I just said in Spanish right now was, if these people aren't going to help us, then they need to resign. They need to get the hell out of here.
You know, I think first and foremost, what this should signal to our executive leadership is that despite the $1 billion that went to the legislature this last session, despite the promise of Measure 110, there's no time to waste, right? This is more than just throwing money at the problem. We need somebody who's going to say, this is where we're going to be in 6 months. We hear you, there's no detox beds. I'm going to create and demand that we take action and construct 50 detox beds in every place that needs it. I will do whatever it takes to get the Narcan we need so that people don't lose their lives. We will open up residential treatment centers. You know, I've been begging for recovery support service money for 10 years. And it's finally starting to come, but it's not coming fast enough. And we need a plan. We need a way to hold ourselves accountable as a state. We need a way to say, okay, Roberto, okay, Amanda, you're saying your community needs A, B, and C. We're going to get it to you. We have a quantifiable, goal to reach, and then we're going to reach it. And if we don't, we're going to hold people accountable. So we need the urgency for this issue that the executive branch took with COVID. Now, I'll say not everybody agreed with the way we handled COVID here, but we fucking handled it. Like, the government handled it. You're gonna wear a mask, you're not gonna wear a mask, this or whatever. We're gonna do whatever we need to do to make it happen, and we're gonna do it expeditiously. You know, I run for D, and then I'm the chair of the Alcohol and Drug Policy Commission. That's a commission that creates a strategic plan to address the crisis. We have lots of, you know, quantifiable goals in it that are really basic. You know, we should increase recovery and reduce addiction, like 2 really simple things. And if you're gonna run a big business, you should be held accountable to really simple goals, right? So are we doing those things? We don't know. Where's the dashboard that says we're making progress or we're not? You know, throwing money isn't just the only solution here. So I meet with the governor's office monthly to talk about how we can't take action for whatever reason, right? And I've done that. And so I hope that the next governor, whoever it is, sees us out today, and it's a signal to them that we need this to be the principal interest, you know, of the next 4 years. So I do want to give a shout out to Mike, because you know, Mike takes it on the chin. Mike says all the things that a lot of us want to say but are scared to, the people in power, you know, and he does that, and that's the role he plays, and I appreciate it. So we come up with a 12-step plan to figure this shit out. You want me to start off with the first one?
Yeah. Yes.
Okay, so the first one is create a coordinated response. We want to create a temporary 3-year emergency office of addiction recovery with full authority over everything: OHA, behavioral health, public health, OLCC, ADPC, Measure 110, OAC, and the Opioid Settlement Committee. Somebody in charge to make sure that everybody's going towards the same direction, or going towards the same goal. Sorry, going in the same direction towards the same goal. That'd be the first thing. Put somebody in charge and give them the authority to fix the mess that we're in.
Second step, the second emergency step we need is to put one person in charge who is accountable. I think it should be Tony V.
Yeah!
Me too! The folks that are running the Oregon Liquor Control Commission, the Oregon Health Authority, the Alcohol and Drug Policy Commission, they're all doing their own thing, and they're just sort of bumping up against each other. We need one person in charge, and we need one point of accountability.
Yeah, and you know, let me be clear, there's a ton of really good people in the state doing a ton of really good work. There's a ton of really great people inside of Oregon Health Authority. There's great elected officials and stuff. The problem is really that every time we try to address the issue, they create another committee and shit. Like, you know what I mean? More and more process, and it's really slowing down the need for an expeditious response. We need to stop poisonings. Like right now, we need to stop poisonings. We need to distribute adequate supplies of Narcan to every high school, college, and provide immediate training to administrators, teachers, and families. We need to do that right now.
Step 4, we need to educate and warn the public. Parents need to know about fentanyl. Kids need to know about fentanyl. The other thing that was mentioned, I'm going to stress it again. Alcohol-related deaths went up 73% in the first year of COVID. OHA finally started to launch an alcohol arms campaign called Rethink the Drink. It's ready to go. This is National Alcohol Awareness Month. And somebody that works in this building said, I don't have time to review it. It's indefinitely delayed.
It should not be on the community to raise funds to do a public health awareness campaign. Let me be clear. They already tax us to address public health. They need to rapidly get out that messaging. In addition, they need to rapidly build the workforce. We need to create an Office of Behavioral Workforce Development, give it the resources and the funds that it needs to recruit, train staff, and pay our peers, our CADCs, our QMHAs, our QMHPs, living wages right now.
Step 6, release the Measure 110 money now. This ballot measure passed 18 months ago. Yes, 300 organizations applied. There are 300 applications. 18 months to read 300 applications? It's ridiculous. Get the money out the door to the recovery organizations now.
Immediately create more freaking detox beds. This is what I'm talking about. We can put a $1 billion into the system, but if we don't put it into the right places, it won't work for people, because people can't go get the services they need or start their journey because they can't get into detox, which is for most people the first step.
Where do we go? Oh. Step 8, immediately create 7-day respite centers, peer-led respite centers. We all know somebody who's out there in a meth psychosis or an alcohol psychosis, and they can get out of detox, but they're not prepared for treatment. We need to fill in that gap there for those folks. There's no reason we can't set that up. We set up 2 field hospitals in this state in about 48 hours when COVID hit, 500 beds each. We can set up respite centers. We can set up detox centers.
And then we need immediate access to residential treatment.
Thanks for bringing this line, bro.
Great to see you.